truly harrowing report has found 7 in 10 nurses are delivering care in totally unsuitable places like corridors, chairs, even store cupboards every single day, and that is becoming the norm.
That's the terrifying thing, amongst many other things that are worrying. Well, the Royal College of Nursing put together this report and they surveyed more than 5,000 nurses. So many of the stories are so raw, we thought we would put together a few examples of those stories and what nurses are dealing with. Now, their words are spoken by actors.
Cardiac arrest in the corridor with no crash bell, crash trolley, oxygen or defibrillator.
A patient died in the corridor but wasn't discovered for hours.
The department's overcapacity on a daily basis, leaving patients being cared for in corridors, on chairs, on ambulance trolleys, in relatives' rooms, in viewing rooms, anywhere where there's a space.
I had to change an incontinent, frail patient with dementia on the corridor by the vending machine.
2 dying patients being crammed in next to one another with no privacy for their families. It's like watching a horrid film that I can't stop.
We are caring for almost 40 patients in corridor overflow spaces every day. The risks are getting much higher and the impact it has on staff morale is huge.
A 90-year-old lady with dementia was scared, crying and urinating in the bed after asking several times for help to the toilet. Seeing that lady frightened and subjected to those conditions is what broke me. At the end of that shift, I handed in my notice with no job to go to.
Corridor nursing is tiring, exhausting and soul-destroying. It is not nursing.
And joining us now is Professor Nicola Ranger from the Royal College of Nursing, the General Secretary. In a moment, we're going to speak to Katie Bolter, whose 86-year-old father, Wallace, had to wait 12 hours for a bed when he suffered a heart attack. But before we turn to Casey, just to talk to you, Professor Ranger, we on Good Morning Britain, we have emails and texts from our viewers all the time telling stories of corridor care and struggles they've had. So on one level, seeing the stories isn't a surprise, but I think when you look at your report, the scale and the comprehensiveness, these aren't the exceptions. They seem to be, as you say, becoming normal. Were you taken aback by what you found when you spoke to nurses and NHS staff?
We have started to see this pattern over a period of time. As a college, we called this out in June, because even through the summer now, we have seen patients in inappropriate places that were becoming the norm June, July, August. So we're not surprised by this winter, because if you're escalated into places you shouldn't be in the summer, what are you going to do when normal winter viruses come along? But I think what surprised us is we know that our nursing teams are increasingly very concerned about this becoming normalised. When we put out our survey over Christmas and New Year, when actually, let's be honest, nurses in their time off need to be spending times with their friends and family, the scale of this and the heartbreaking of this was just, even for us,
and
harrowing.
You know from your previous life, welcome to Good Morning Britain, first time in your new role, but you know from your previous life working, you know, in nursing acute care, that this is an upturn of devastating reports, but also has been coming.
It has been coming. And I think that's the concern here. Listen, we looked at this and thought, is it responsible for us to put it out there? Because as you just said, Ed, it's heartbreaking. So to see it and read it, but we didn't want to do this to scare patients. We don't want people to be scared to go to hospital, but we do want to tell the nursing story because, you know, not being able to be proud of the care that you're giving, to keep people safe and to be able to give dignified care is devastating for the nursing profession. Well, and it's great to hear their voices. Actually.
Absolutely, and we're going to come back and hear more and maybe even, hopefully, some ways that things can change. Should we talk to Katie Bolter, though, first of all? Now, Katie, good to speak to you this morning. I'm so sorry that it's such a difficult thing you're going to have to talk about. This was your dad, wasn't it, who suffered a heart attack and had to wait a very long time, 12 hours, for help. Tell us the story. What happened?
So my father had a heart attack late on the Friday night, and he was taken in an ambulance. The ambulance came quite quickly. The paramedics were marvellous. They took him on blue lights to Heartlands Hospital, and then he sat in an ambulance for over 7 hours. I couldn't even locate where my father was on the morning. They couldn't find what location he was at. And then eventually I found out that he'd been taken up onto a ward, and that was somewhat 14 hours later, and he was really distressed. He cried like a baby when I got up there. He couldn't even talk to my mum on the phone. He was really utterly distressed.
I mean, terrifying for him to be in that position. How is he now, may I ask?
Yeah. Well, my father suffers with vascular dementia, so he has good days and bad days. He's relieved to be home. My mum told me the other evening that he said if he has another heart attack, he doesn't want us to call for an ambulance. He doesn't want to go back to that hospital again after his dreadful time there. So
because
yeah,
it was so terrifying to be in that position for that amount of time.
Yeah. He was frightened.
Of course he was. Of course he was frightened, and I'm sure it was devastating for those that were caring for him.
Yeah. The thing is, it's hard enough going into A&E or being in hospital. Anybody who has been in hospital knows what it's like if you're going for a scan in a hospital and you have to be wheeled in a corridor to wait to go in for the procedure, and it's cold and a bit miserable and a bit lonely, and you haven't got your room and your cards, and there aren't visitors. But you deal with that because you're waiting for a procedure. But the idea that you would be in that situation for hour after hour after hour, that is what is just so shocking and terrible.
Do you agree, Katie?
I do. I just think something needs to be done, and hearing all the nurses' stories as well, it's quite distressing to hear on the other side of the scale as well. It's a broken system and something needs to change. These are our loved ones, and it's really, really distressing to see the state of the hospitals now.
It's so awful, and I'm sure we've got Professor Nicola Ranger, head of the Royal College of Nursing, with us, as I'm sure you've heard what she had to say. Thankfully, Katie's father is still with us, although devastating, I'm sure, for you to hear that he doesn't want to go back to hospital because it was so awful. So many other comments from viewers this morning. Gina says, the paramedics took my mum to hospital. She was experiencing excruciating back pain. She joined patients who were lined up in the corridors. After 5 hours of excruciating and increasing pain, she was finally in a panic, rushed into a side room, and within 10 minutes passed away. Now, horrific for that family, but also horrific for those nurses to know that they couldn't do what was needed. I mean, on every level, this is a disaster. What can be done?
We cannot disagree with everything the government is trying to do. We've listened very carefully around the plans, and we, as a college, completely agree with them. The challenge is the scale and the pace, because actually we have got a real burning platform. And everything that's being done for patients, we agree with. The thing that we're not hearing, though, is what investment and what acknowledgement of the nursing profession and the crisis it is in. Now, in many settings, in all settings, particularly in acute hospitals, the constant 24/7 presence is nursing. They are the people that are trying to keep people safe, and they are the people trying to give dignified care.
Absolutely.
And we've got a nursing crisis.
Is it freeing up space? Is it flooding it with more nurses? Because we know that that's not instant, don't we?
It's not instant. It isn't instant, but we need some hope, Kate.
Yeah.
Because actually what we haven't got is when is hope coming? When is the plan to get nursing in the UK invested in, valued, actually, so that people start to give the profession hope? And that does need to happen. And I think there are some things that we could do and that we can do. So I think there is something about the patients that don't need to be in hospital.
Right.
There is capacity there. But actually, let's invest in social care. There are some things we could do now. Pay them their travel now, their petrol money, to go from place to place. There are long-term solutions, but there are things that can happen.
But the government
now.
has said the social care review is going to take 3 years. And then the Prime Minister on Monday saying the solution is artificial intelligence. What do your members feel when they hear that artificial intelligence is going to sort this out?
It has its place, but it's not going to look after patients. And that is primarily what we need, to make patients feel safe, cared for, listened to. And of course, it's great as a tool. But at the moment, we need people and particularly nurses, to look after patients. And we need to sort this out. I take the point that some of this needs long-term reform. It's taken years to get into this mess, and it will take time to get out. But we would urge the governments, there are some things we could do now that actually we need to focus on, and we need hope.
Nicola, I think this will be not the last time we have a conversation with you in your role as General Secretary of the RCN. Thank you very much.
Thank you.